If you are a lady who finds it difficult to differentiate between a normal vaginal discharge and abnormal vaginal discharge, then this video is for you. If you are coming across my video for the first time, this is Care Sports, a place I talk everything related to health and healthcare. So if you want to join the family, you can click the subscribe button or you click the plus icon so you always get my content anytime I upload them. Vaginal discharge is a natural and normal occurrences in a woman. Vaginal discharge can serve a lot of important function in a woman's body, ranging from cleaning her vagina to lubricating the vagina, maintaining your vaginal pH, and also helps you in fighting what? Against infection. Now, you might want to know, what can a normal vaginal discharge constitute? What constitutes a normal vaginal discharge? First thing first is the color and the consistency. A normal vaginal discharge can vary in both in color and in consistency all throughout your menstrual cycle. Now, depending on which stage you are in your cycle, whether you are in your first stage of cycle, you know that the first stage you can be bleeding, and some people, when they are bleeding, the first blood can be brownish, it can be pinkish, depending on what you are seeing. It can be pure red. So when it is this color, just note down you are still in your bleeding period. Now, after your bleeding period, you might go to a kind of a bit dry stage. At that time, the vagina is not supposed to be totally dry. Remember that. If you notice a dry vagina, then you know there is a problem. There is a problem in your hormones. So it's time for you to speak to a doctor. With time, towards when you are approaching your ovulation, it tends to be clear and, sticky. It becomes sticky that you are ovulating, knowing that you are ovulating. Now, for some people, when you are sexually aroused, you might notice that clear discharge again. When you are having intercourse, you might also notice that clear discharge or creamy color. Now, in this color, if you notice anything that is a kind of yellowish, greenish, or any other color outside these ones I have mentioned, please know it is time for you to speak to a doctor. It is abnormal, totally abnormal. When you notice that yellowish kind of color, you know that you might be having what? Infection. So it is time to speak to a doctor. Next thing I want you to consider is the odor of your vaginal discharge. Now, a normal vaginal discharge is not supposed to have any kind of odor. Maybe if we might say, if you can smell it more, you might get something like a musky or metallic odor, which is normal. Anything outside that, if you notice a fishy odor, there is infection. If you notice a foul smelling odor, something is wrong. So it is time for you to see what? A doctor. Next thing I want you to consider is what? The volume and the frequency at which you are getting that vaginal discharge. Now, the most important thing you need to consider or bear in mind is that if you see or notice anything abnormal from what you used to know, you know your vaginal discharge, what it looks like and how frequent you can get them. If you notice anything abnormal from that, you know there is a problem. In exception of pregnancy, bear this in mind. In exception of pregnancy, when a woman is pregnant, her vaginal discharge tends to be a lot more than when she is not pregnant. So if you notice anything that is abnormal from what you used to know, then you know it is time for you to speak to a healthcare provider. So guys, what I'm saying in conclusion is that you need to put these 4 things into consideration in determining whether you have a normal vaginal discharge or abnormal vaginal discharge. The first one is the color, second is the consistency, the volume, and the odor. If you check all these things and you did not fall in any of these things, whether fishy color, greenish, yellowish, or the volume is too much or is less, like I said, you should not have a dry vaginal discharge. Please, after checking all these things and you find out that it is abnormal, please speak to a healthcare provider so that they will give you a personalized advice, a personalized medications just for you. Please do not go about treating yourself or taking any concussion or inserting anything into your vagina. Very important. Now, if you find this video informative, please do not forget to hit that like button and share the video. Why not? Why can't you share this video? Okay, bye. See you on my next video.